Well, hey guys, it's February. Not only is Valentine's Day around the corner, but it's also American Heart Month. Today, I'm going to be sharing with you 10 signs on your skin of heart disease not to miss. What exactly is heart disease? It's actually several different types of disorders. However, most commonly, it's something called coronary artery disease. Basically, problems with the arteries that deliver oxygen to your heart. Your heart becomes deprived of oxygen and you have, well, a heart attack. Heart disease can be a silent killer, meaning many people have it and they don't have other signs and symptoms, they're not aware. Skin and nail signs of heart disease can be early warning signs, clues, and dermatologists often diagnose heart disease when they discover these findings on a skin or nail exam. So don't just think we're all about Botox, filler, and acne. We also diagnose many life-threatening health conditions. Sign number one is swelling in the feet and the lower legs. This is called edema. Swelling in the feet and lower legs is a clue that your heart is not working properly to pump blood around and circulate. Many diseases of the heart can cause fluid to build up in your lower legs. It's called pitting edema because if you press down, your finger will leave a depression in the skin. It takes a while to fill back up again. It's basically a collection of fluid in the lower legs. When the heart is not pumping and circulating things around efficiently, well, there's a buildup of fluid, often in the lower legs, starting with the tops of the feet, but over time it will start to creep up the lower leg all the way up to your thigh. Many different types of heart diseases can cause a buildup of fluid in the lower legs, whether that be coronary artery disease. Maybe you have an underlying problem with how the heart beats and you develop an arrhythmia. You can develop what's called heart failure. So this is an early warning sign that things are not circulating around. Now, if you happen to develop edema once in a blue moon, don't panic. There are other causes of lower leg swelling that are not as deadly as heart disease. It's not uncommon, for example, for women to develop lower leg swelling in pregnancy. As you can imagine, with pregnancy, you have a lot more blood being produced in the body, a lot more volume to circulate around. Plus, you have the weight of the baby kind of slowing down return. Doesn't necessarily mean you have heart disease. When in doubt, always show your healthcare provider any of the things I'm pointing out. It might just save your life. Number two is blue or purple skin discoloration. Now, it's not unusual for the skin to turn bluish, purplish when you get really cold. But if your skin remains blue or purple once you have warmed back up, that is worrisome that you might actually have some sort of blockage in a blood vessel. For example, there's something called blue toe syndrome. People can develop these bluish violet spots on their toes, and this is actually a sign of something called cholesterol embolism. An embolism is basically something that floats around in your blood and can get stuck in a blood vessel and plug it up. Cholesterol can get dislodged from plaques in your arteries, and it can make its way to the little blood vessels in your toes and basically plug them up. There are a lot of other health problems that can cause blue toe syndrome. It's not the only one, but it definitely can be a clue to underlying heart disease. The medical term for bluish discoloration of the skin is cyanosis. Along those lines, you can develop this bluish, purplish, net-like pattern, usually on the upper thighs, but really anywhere. Now, this is something that a lot of people will develop in the cold, when they get cold or chilled. It's called Livedo reticularis. Reticularis just means net-like. It kind of looks like a fishing net of blue discoloration on the skin. Many people develop this when they get cold, but if it persists when you are warmed up, that is worrisome for perhaps an underlying problem with blocking arteries and leading to this accumulation of blood in the tissue. Locally, it's not circulating around, oxygen's not circulating around properly, and you're getting a net-like pattern of kind of cyanosis. It's important to recognize these signs of cholesterol emboli because not only are they part of heart disease for some people, it's possible that cholesterol emboli are getting lodged in other tissues in your body. You just can't see them. Remember, the skin is a window to what is going on internally, and it provides many, many clues. And we're fortunate that we can see it and pay attention. But these kinds of things may be occurring in organs like your kidney or your lungs, and therefore causing problems with oxygenation in those areas. So it's a really important warning sign to not ignore. Livedo reticularis can also happen as part of underlying autoimmune diseases, most commonly lupus. Lupus is an autoimmune disorder where there are a lot of different skin findings, and Livedo reticularis is one. Patients who have lupus, their blood is a lot stickier, so they are vulnerable to developing this, as well as problems with their heart. Livedo reticularis also can develop with certain medications, so it's not always a slam dunk, oh my gosh, you have heart disease. So don't panic if you see these things, just bring them to the attention of your healthcare provider. Number 4 are yellow, waxy growths on the skin. Basically, they are cholesterol deposits in your skin. They are painless. They often happen around the eyes. They can also happen on the lines of your palms or on the backs of your legs. If you discover these, definitely bring them to your attention of your healthcare provider. Blood work is necessary to evaluate the lipids in your blood and your cholesterol. Unhealthy cholesterol levels require treatment to lower the cholesterol and prevent life-threatening heart disease. Once you get the cholesterol levels under control with medication, these bumps can sort of go away. However, sometimes they don't go away, and there are certain treatments that a dermatologist can perform to get rid of them. For example, they can be treated with something called electrodesiccation. Basically just kind of singes and melts away the little fatty deposit. But treating the underlying problem with the blood cholesterol is paramount, again, to prevent life-threatening heart disease. Now, these little yellow growths, they come in a few flavors, if you will. One that I know a lot of you guys have asked me about is called Xanthelasma, little yellow firm bumps around the eyes. But you can also develop cholesterol collections under the skin. It's more of a larger nodule. It's called a xanthoma. Another sign of a problem with the blood lipids is an eruption all of a sudden out of nowhere of many little firm yellow waxy bumps, usually on the torso, the upper back. These are called eruptive xanthomas. They look like warts, or they also look like molluscum, which, as a side note, I recently did a video all about molluscum, these little viral bumps that are common in children, but anyone can develop them. Check that out if you are wondering if that might be what you have. But eruptive xanthoma definitely can look like them. They have this yellowish appearance. With eruptive xanthomas, the underlying lipid abnormality on your blood work is usually a very high triglyceride level. If you didn't know, dermatologists, we don't just look at the skin, we look at the nails as well. We are the medical experts on all things nails, and nails can tell you a lot about a person's health if you know what to look for. As a side note, I have many videos on this channel detailing different nail findings associated with different underlying health problems like thyroid disease. So definitely check those out if you are at all intrigued by things that go on in your nails. Some patients develop down curvature of the nails and a widening of the tip of their finger. This is called clubbing. This can be the result of a heart infection, heart disease, or a lung problem. It also can be completely harmless in some people. But basically what is happening is you have thickening of the skin around the finger, and you also have extra growth of bone there. It's thought to be the result of problems with oxygenation to the tissues, perhaps. But one way to evaluate for this is to put the index fingers completely together, flush. And normally you should see a little diamond space between them. That's called Lebeson's angle. If that disappears, then that's a clue that you have clubbing. If you still have that little diamond space, congratulations, you do not have clubbing. Another nail finding associated with an infection in the heart is called splinter hemorrhages. Basically, these little red lines that are collections of blood under the nails. These are really common. They're not very specific for infections of the heart. They're very common as a result of trauma. Men tend to have them more so than women, but anyone can develop them. They're also found in patients who have psoriasis or nail lichen planus. So if you have these, don't just think, oh my God, I have an infection in my heart. If you have these and you have a high fever and an irregular heartbeat though, that is a clue for something called bacterial endocarditis, a serious life-threatening infection in the heart as part of heart disease, requires treatment with antibiotics. You can get a buildup of collections of proteins, essentially, in different organs, including your heart. This is called systemic amyloidosis, and a skin sign that this is going on and could, again, be affecting your heart is the development of these smooth, waxy lumps on the skin. Not only can they be present in the skin, the heart, but they can be present in other organs. Really important to identify them because they are a clue that maybe the patient has an underlying systemic amyloidosis. While those are typically painless, you can develop painful bumps on the palms and soles, skin-colored little nodules These are called Osler's nodules, named after some famous doctor who identified them. This is another skin sign that you have an infection going on of the heart. It's called infectious endocarditis. Those little nodules are important to recognize. They usually last anywhere from a few hours to maybe a few weeks. They do go away, but it is imperative that the patient be treated with antibiotics to treat the infection in their heart and bloodstream. And last but not least, you can develop little brown, reddish spots on the palms and soles. These are also a sign that you have a bacterial infection in the heart, called, again, bacterial endocarditis. These, in contrast to the little Osler's nodes, are painless, and these are called Janeway lesions, again, named after some famous doctor who identified them, but they are an important clue of an underlying heart infection. Similar to Osler's nodes, they will clear up and go away without any treatment on their own. However, treatment with antibiotics is essential to treat the actual infection in the heart. All right, y'all, so that's a wrap up of 10 skin and nail signs of heart disease not to miss. Do you guys like my little floating heart back there? I had to just put it in the background today since Valentine's Day is coming up and we were talking all things heart in this video. Heart disease is no joke. It can be a silent killer. It's very common, and knowing some of the signs to identify, not only in yourself, but maybe in a loved one who might be, sick in the hospital, it really can save the day. I'm telling you, skin is a clue to what is going on inside, internally, and dermatologists can save lives just by looking at people. So hopefully this video was educational to you. Let us know in the comments if you or someone you love deals with heart disease, has had a heart attack. It is very distressing to go through. If you like these kind of videos on skin signs of medical problems not to miss, I have them all saved in a playlist. I have a video all about thyroid disease, high cortisol, you name it. I have a ton of videos in that playlist. So check it out if you like to learn about clues to underlying health problems. In fact, I will put one of my more recent ones on the end slate. You can watch if that is of interest to you. But if you like this video, give it a thumbs up, share it with your friends. And as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.